Hi, Mr. Chavez. As I said earlier, I'm going to ask you some detailed questions about your symptoms of PTSD. But first, I want to get a better sense of the traumas you've experienced in your lifetime. Let me just remind you that I don't want to go into details about what happened in each of your traumas right now. We'll have plenty of time for that later. As I said, I have some very effective treatments where we can talk about the details of the traumas, but for now, I just want to get a better sense of all the traumas you've experienced. I'm interested in things like how many traumas you've experienced, what ages you were at the times of the traumas, and that sort of thing. Does that make sense?
I guess so, yeah.
Okay. Do you have any questions?
No, I don't have any questions right now.
Okay. Let me start with what you've listed for your traumas. You wrote that you were in combat, right?
Yes, I was deployed.
Okay. While my expertise is with PTSD, I've mostly worked with civilians and not many veterans. I understand some of the terms used by veterans, but not all of them. So I want to be open to learning. Is that okay with you?
Of course. I appreciate your willingness to learn.
Be aware that not all veterans served in a combat environment. Those that have been in combat have been exposed to varying degrees of danger, and the types of traumatic experiences can vary widely. Most veterans who have been in combat were in constant danger during their deployment. In order to get a clear picture of the veteran's trauma exposure during deployment and their service in the military, think in terms of number of traumatic events in each deployment. Also, if you are not familiar with the military and the experience of veterans, it is important for you to ask questions about the military and the jargon used.
Great. I also don't want to make any assumptions about what you've experienced, so I appreciate your patience. First, it sounds like being deployed means that you served in the military, but you were also assigned somewhere special. Is that right?
Yeah, it was a special duty assignment. It could be temporary or permanent and for different lengths of time.
Could you tell me about where you were deployed and for how long?
I was deployed 3 times. The first time in Iraq from 04 to 05, and the other 2 times in Afghanistan from 06 to 07 and 2009 to 2010.
It sounds like you were there for about a year each time. Is that right?
Actually, no. The first deployment to Iraq was for a year, 12 months, and then the other 2 were for 6.
Could you give me a sense of what your duties were?
I was a medic there, and I did that all 3 times.
Consider that as a medic, the combat veteran may have had many traumas in aiding the wounded. It is important to note that medics are engaged in triage and are not physicians. Thus, they can often feel helpless in treating the wounded, leading to potentially more traumatic experiences. Your decision point here would be to assess for 2 types of trauma: loss of soldiers in his or her role as a medic, and other traumatic experiences where his or her life was threatened.
So I guess as a medic, you had to assist other soldiers who had life-threatening injuries. Is that right?
Yeah, it was rough.
Do those memories come back to you now?
Do I have to talk about that?
You don't have to go into a lot of detail, but it's good for me to get a sense of what happened.
There was this one guy I should have been able to save. I mean, there were more than one, but this one keeps coming back to me. We were taking heavy shell fire, and he took something to the eye, and he just couldn't stop bleeding. I did all I could, but I just couldn't save him.
Sounds hard. How long were you there with them?
It felt like forever, but it was probably only like 10 minutes.
It sounds like that one in particular comes back to you. How does that experience usually come back?
After he passed, I pulled out a picture of he and his wife and his kids, the same age as my kid now. Every time I think about it, I just see and I smell the blood, just blood everywhere. I can't shut it out. But no,
Do you remember his name?
I couldn't forget it. His name was Johnson. And I could turn over the picture and see the names of his kids. Bud and Janie.
Stop. You're doing a good job. Just take a couple breaths.
Importantly, as a clinician, you are looking for balance. You do not want to rush your veteran through the memory, yet you do not want him to go into too much detail. If you rush, you will feel invalidated and you will lose his or her trust. If you go into too much detail, You will lose your focus of assessing for traumas and run the risk of this turning into a therapy session.
That was a rough one. If you're getting triggered with your own child now, it may be one we want to work on. But let's move on for now, if that's okay. I'd like to continue to get a sense of the other traumas you've experienced while in combat. I know it might feel like I'm opening you up, but remember that's why I said I didn't want to go into too much detail. This is why. I need to get a sense of the extent of all the traumas you've experienced.
Providing a structure for your client to understand what you are doing and why is extremely helpful to the veteran with PTSD. If you need to close him or her down because you are running out of time, simply explain what you are doing. I do not mean to shut you down. I want to make sure we do not run out of time.
So that was one of the worst experiences of losing someone you were trying to save. How about your life being threatened? Can you tell me how often your life was in danger during your 3 deployments?
Almost every day, my third deployment in Afghanistan. Not as much in the first 2, but there were the times there too.
Okay. Let's focus on your 3rd deployment. You said your life was in danger daily.
Yeah, we took a lot of mortar fire.
What was your most difficult experience during that deployment?
It's hard to say. There were so many of them.
Like the trauma of losing Johnson, did you lose anyone close to you?
I guess I lost around 6 guys that I'd consider friends. They were all during the third deployment.
Many veterans experience multiple traumas during deployment. It is important to understand what their most difficult experiences are in order to hone in on what needs to be the focus of treatment.
I know I'm pushing you for the worst traumas. I want you to hear that even though some were worse than others, all of them were bad. And any one of them could have caused you to have PTSD. The fact that you had so many really speaks to the reason why you have PTSD. These experiences have profoundly affected you. Which ones stick out to you now? Which ones come back to you?
There's this one that was particularly bad. It was during my third deployment. We were in a convoy. I was in one of the last ones. I was usually the first. We just gotten out of a firefight. Still had to make it through this dangerous area. First vehicle hit an IED.
Okay.
It was just a huge explosion. 2 of my friends died. Danny and Sam.
Huh.
It's my fault. I should have been in the first vehicle. I knew the ropes better than those guys. When it was safe enough to go get them, I tried all I could. I couldn't save them. There was nothing I could do. They were dead. There's so little of them left.
You're doing well, John. What happened to your vehicle?
We were shaken pretty badly. The second and third vehicles sustained damage, and besides my 2 friends that died, a bunch of people were injured.
Can you tell me more about what happened, what you did?
Well, I couldn't see much from the vehicle. I heard the explosion. It was huge. But when it was safe, I ran to the guys and assessed the damage. I saw they were dead, and I had to go tend to the other people and their injuries. I patched them up, and the helicopters came for them, and then got back in the convoy just like usual.
Sounds like you didn't even have time to process their deaths, to feel those losses.
No, feeling put us in danger. Put us all in danger.
So to survive, you had to shut down.
Yeah.
You know, John, it strikes me that if you were in the first vehicle, you could have died too.
playing in my head. Them telling me to get in the last Humvee.
It sounds like you're feeling the loss, but also something about it not having been you.
It should have been me. If I were in the first Humvee, maybe I would have seen the IED and we would have not hit it. I kind of.
You know, blaming yourself is part of PTSD too, right?
No, I didn't know that.
It's one of the symptoms of PTSD. As well as replaying the image in your head over and over again. Just like you're describing.
That makes sense.
So, was that the worst experience of your third deployment?
Yeah.
It sounds like there were others. To help me get a perspective, what were the worst experiences of all 3 deployments?
Aside from Johnson and Iraq, all of the worst ones were the third deployment.
Okay. And the one you described with your 2 buddies that died, Diane and Sam?
Yeah.
How many others in the third deployment were in the worst category?
I'd say maybe 3 or 4.
Okay. I'm not going to have you go into more detail about those, but we'll come back to them. For now, we have the worst 2, right? John, I know I'm asking you to put them into categories and quantify them, and that's really hard because they were so traumatic for you. I want you to know I do recognize this. Let me tell you why I'm asking about worst traumas. First, it helps give me an idea of all the traumas you've experienced. And second, it's my expectation that if we identify the worst and focus on those in treatment, the others will improve as well.
Makes sense.
Now, let me get a sense of your life before and after the military. Have you had any other traumatic experiences in your life outside of the military?
Yes, I was in a serious car accident when I was a kid.
Sorry to hear that. Tell me more about what happened.
I don't remember much just because I was so young, it was so long ago. But I remember being in the car with my mother and my brother. A car rear-ended us and my mother's seatbelt malfunctioned and she was thrown from the car.
How old were you?
I was 8.
What do you remember?
I just remember being happy one moment. And lots of loud crashing noises. Kind of blank for a moment and then just tons of commotion.
Sounds pretty scary.
Yeah, it was. I was mostly scared for my mother, but she was okay. She had to stay in the hospital for a while, but I talked a lot with my dad and my grandma, and that helped me out.
Does it come back to you at all? Like the combat traumas do?
No, nothing like the combat traumas.
Okay. That's good to know. What other experiences have you had outside of the military? Anything since you've been discharged?
Yeah, about a year ago, I was robbed at gunpoint while drawing money from an ATM.
Wow, you've really been through a lot. What happened?
I went to draw money from an ATM. I hate drawing money from ATMs after hours, but I had to pay my cousin back for a present that he bought my mom that night. So I go to the ATM. I didn't see anyone around. And next thing I know, I've got a gun pressed on my back. He said to draw $300, which was the max amount that I could get. He said he would shoot me if I moved. And he said he told me to count to 100. I did, and he was gone. I didn't get a good look at him, and I couldn't tell the police what he looked like. He wasn't calling.
I'm so sorry to hear this. You've been through so many difficult things in your life.
Yeah. I guess the worst part of it is that everything just got worse for me afterwards. The sleeping got worse. Nightmares about combat. It's gotten to the point where I don't even leave home.
Often, combat veterans experience a variety of traumas over their lifespan. It is important to ascertain the worst traumas to determine which trauma will be the primary focus of therapy.
I see. It sounds like you were coping well right up until about a year ago when the robbery happened. Is that right? And how does the robbery fit in the severity of the combat traumas? Is it worse or is it just kind of out there?
It was scary, but it's nothing like the combat traumas.
I think I have a good sense of all the things that have happened in your life. And unless we've missed something, I would like to change gears and move on to talking about symptoms. But first, John, I want to say that I recognize that you've been through a lot in your lifetime. And any one of the experiences that you described today could have caused you to have PTSD. You've had many, many life-threatening events. Although you may not feel like you did enough, as you said earlier, I want to acknowledge the survival strategies both in the middle of the traumatic events and since then trying to get your life back. It takes a tremendous amount of courage to do what you've done, and I'm glad you've taken the next step by coming into therapy. We have some pretty effective treatments that will help make sense of what's happened to you and help you get your life back. How does that sound?
Good. I hope I can get there.
I don't see any reason why these treatments wouldn't work for you. If you have any questions along the way, just let me know. I want to keep you as informed as possible about what we're doing and why we're doing it.
That sounds good.
Okay, so let's move on to symptoms.